Hey, it's Dr. J here, answering your most frequently asked questions about pediatric dentistry. The question I'm going to address today is what sedation options do I have if my child needs sedation for dental care? There are quite a few different modalities where we can do sedation safely for a child who has acute anxiety or just simply can't cooperate to get dental care done safely without sedation. And we can break it down into four general categories. The first category is probably the simplest and most commonly used one. It's called laughing gas, where it's not a true sedation, it's more of an anxiolytic, and the child breathes in the gas and they're awake and alert, but it really makes it a little bit smoother for them as far as the experience goes. One level higher than that would be something like the category of oral sedation, where the child can get some sort of a liquid, typically it is, where they drink, and that liquid can have any one of many combinations of medications in them um, to give different effects when it comes to feeling a little drowsy, a little relaxed, a little happy, or forgetting the experience or what have you. It really depends on what goes in there. And typically, the aim with oral sedation is to still keep the child awake and relatively alert, but just helping them be drunk and somewhat happy. Um, a level above that, sort of our third category of oral sedations, would be medications that are administered via an IV, where the child is hooked up to all the monitors, but they no longer are awake and alert. They're basically kind of in la la land. They're still breathing on their own. They're typically not paralyzed. It's just they no longer have a sense of where they are. And this is just about always done with multiple providers, so an anesthesiologist as well as a dental provider. And the other um, two techniques that we talked about are typically only done by the provider who's doing the dentistry. Now, one level above IV sedation would be the category of general anesthesia, where this is kind of what you usually think of when a child is taken to a hospital and there's paralytics involved and they're intubated and what have you. And that's probably the most involved modality of sedation. Now, all of these could be done appropriately and safely by the trained administrators, but certainly there's room for concern and doing your homework and making sure that the modality of care that's being designed for a child makes sense and you understand your alternatives, and it's done by the most trained individuals in the safest possible environment. I do recognize anytime we're talking about sedation, it's anxiety provoking and it's hard to think about the risks involved and you're the right thing by researching. But yes, it could be done safely, and yeah, keep doing your homework and hopefully you'll find a good solution. Until next time, keep the questions coming, keep on smiling, and we'll see you guys with another session of hashtag Ask Dr. J.